Myself, Rajita. I welcome you all to today's session. So, here today in this session, we are going to discuss regarding a very basic but very important topic of nursing care, and it is the peri-operative care. So, what it is, let us discuss now. So, first, before going in details of the topic, you should know the meaning of the term peri-operative. So, as the name itself is suggesting, that it is basically indicating the time around the surgery, or we can say basically it is suggesting around the time of surgery. So, what it is and what is the specific care and basically the nursing role in this perioperative phase, let us discuss today. So, in clinical terminology, we are going to say the perioperative care. It is basically a practice of patient centered, multidisciplinary, and integrated medical and nursing care of the patient from the moment when the contemplation of surgery until the time of full recovery of the patient. So basically, it is suggesting that it is a nursing and medical care, or we can say a integrated nursing and medical care, which will be basically a patient-centered care. So the main goal is the promotion of the health of the patient, right? So it is a patient-centered care, and definitely it is a multidisciplinary care. So when we are going to discuss in detail regarding the perioperative care, we are going to see not only the nurses are responsible for the promotion and the cure of the health of the particular individual, but many other medical professionals will also be associatively working together to promote the health and cure the disease process of an individual. So that is the reason why we are calling this perioperative care as a patient centered, multidisciplinary, and integrated medical and nursing care. Now, as we have learned, the perioperative is basically suggesting the around the time of surgery. So it means that this particular care will be initiated to that patient when a surgical procedure has been planned for that patient until the recovery of the particular individual. So now we are going to discuss in detail about this perioperative care into three different phases. So the distinctive phases that are included in perioperative care are preoperative phase, intraoperative phase, and post-operative phase. So before going to discuss regarding each one of the phase, you should remember or you should learn about the basic of surgery. So surgery is basically an art and science of treating the disease or injuries or maybe the deformities through our instrumentation and our operation. So as we learned that any injury or any deformities or any disease condition, if it is affecting a normal individual's health, we are going to perform surgeries through instrumentations and operations by which the patient will be recovering. So this is basically our art and science, right? So now we are going to learn that the surgical experience almost always will be involving multidisciplinary interaction, right? Many of the medical professionals or different medical professionals will be coming together and will be achieving the goal of the surgery. Now also it will be, there will be interaction with the patient. Even with the patient, there will be interaction of the medical professionals like the surgeons, anesthesia care providers, nurses, even the physicians, as well as the caregiver of the patient who is going for the surgery. So it is important to note that here nurses plays a very important role to integrate all the medical professionals with the patient and caregiver. Basically, here the nurses plays the vital role, or we can say the nurse have the role of advocacy for the patient, right? So here we are going to see the nurses will be interacting with the patient and their caregiver, with the physician, surgeons, and many other surgical team. So as we have learned here that surgery is the main procedure will be done for the client to, or for confirming the recovery of that particular client who is diseased, right? So what can be the purpose of the surgery? Now only surgery won't be done to cure the condition. Sometimes we are going to see for diagnosing purpose also the surgery can be used. Even then, the perioperative care should be provided to the client from that time when the surgical plan has been taken place till the time of recovery. Even the surgery can be performed because of, or with the purpose of to curing the condition. Now, as we have learned, any pathological condition, if it is present, removing that particular or eliminating that particular part which is having the pathological condition is the main goal of those surgery, the purpose of which are to cure the patient. The next purpose of surgery can be palliation. So basically palliation is nothing but a elevation of the symptoms. So here we are going to see, just to treat the symptoms or just to minimize the symptoms, we are going to perform the, or the surgeons are going to perform the surgeries. The next purpose of the surgery can be prevention. So suppose an individual is having presence of certain mole which have the chances of the malignancy. So to manage that, we may see a decision can be taken over to removal of that particular mole. So this kind of surgery we consider to be as a preventive surgeries. The next purpose of surgery can be cosmetic repair. So cosmetic repair, often we will be able to see this will be done for the patient with burn, or maybe who are having external injuries. To maintain their body image, we are going to see the usage of these cosmetic surgeries. Next is exploration. So sometimes even because, or to perform surgical examination, to determine the actual cause of the symptoms of the patient, the surgery will be done. So these are the purposes of the surgery. Now for each and every type of surgery, so whether the surgery is being performed in an outpatient department or inpatient department, or the purpose of surgeries, that can actually vary from patient to patient. But it is to make sure the perioperative care should be provided or should be planned for each and every patient who are a recipient of any type of surgery. So now we are going to learn about the types of surgery, which basically depends on the duration of the decision for the surgery. So basically we are going to see here two types of surgery can be there. First one is elective surgery, or which we can call it as a planned surgery. Now in elective or planned surgery, we are going to see, in case of this kind of surgery, our individual client will be present with certain symptoms or pathological conditions which is affecting their lifestyle or maybe affecting their physiological activity in their body. So here priority decision will be taken to go for or to perform a surgery in order to cure the disease condition of the particular individual. The next type of surgery is emergency surgery or unplanned surgery. Now, in this case, we are going to see in an emergent condition, maybe the surgery would be planned and performed. No prior decision would be taken here. So I hope you are clear about the elective and emergent surgery. For each and every surgery, we are going to see the usage or the plan of perioperative care. Now, depending on the types and the purpose of surgery, definitely the phases of perioperative care, or the duration of the phases, or the activity of each and every medical professional's role for each and every phase of the perioperative care will be differentiated. So now, first we are going to discuss regarding the pre-operative care. So I hope till here you have learned about a bit details of the surgery, the types of surgery and the purpose of it. So now we shall start with the peri-operative care, what it includes. So first we are going to read about the first phase of peri-operative care, that is pre-operative care. So what does it mean, or what does pre-operative the term means? So basically, as the term is suggesting, it is the management or the preparation of the client prior to the surgery. That is the reason there is the term of pre-operative, before the surgery. So whatever management and preparation would be done for the client before the surgery, that comes under pre-operative care. Now, this can be actually a simple day care procedure or maybe a major surgical intervention. For each and every type of surgery, there should be a pre-operative care planned for the particular individual depending on their need. So this pre-operative care basically starts from when the decision of the surgical performance has been taken care. So once the surgeon has been planned the surgery, from that particular moment, the pre-operative care plan starts, and it ends with once the particular client is transferred to a operation theater. So I hope you are understanding the pre-operative care will be durated since the decision of the surgery has been planned till the time the person or the individual is transferred to operation theater for the surgical procedure. Now we are going to learn about the role of nurse. So I hope you are understanding, depending on the client symptoms, a surgeon or a physician would assess the client for their disease condition, and after all they will be concluding the diagnosis for a particular disease, and the surgeon will be deciding whether the client is a suitable recipient for a surgical procedure or not. Now once the surgical procedure or the decision of the surgical procedure has been taken care of, now the nurse plays a very vital and important role in the management and the preparation of the client during this pre-operative care. So here we are going to learn about the role and responsibilities of the nurse during the pre-operative care. So basically it includes a certain steps. So the first and foremost important nurse's role in pre-operative care is pre-operative assessment. So in this phase, we are going to see the nurses would be performing a details of assessment during the time of pre-operative phase. The second and major important role of a nurse is the legal preparation of the patient before the surgery. So basically here in legal preparation, we are going to see the nurses would be obtaining an informed consent from the patient prior to the surgery. The next one is the pre-operative teaching. So in pre-operative teaching, we are going to see the client would be taught regarding the surgical procedure, the need of it, the expected outcome, and certain lifestyle modification or certain changes of the lifestyle that they have to adopt after the surgical procedure. Next one definitely includes a physical and psychological preparation of the client. So here a nurse would be assisting a client to psychologically and physically prepare to be or to receive the surgical procedure and to definitely adopt and manage with the post surgery recovery. So last and not the least, the nurses have also a very important role the day in the surgical preparation. So the particular day when the surgery would be taking place, the nurses plays a vital role to prepare the client completely and transfer the client from a unit to the operation theater by preparing completely for receiving the surgical technique. So here, these are the major nurses' role in the pre-operative care. Now, we will be going to see in details regarding each of the role. So the overall goal of the nurses for pre-operative care is determining the physical factor which is directly or indirectly related to surgery. So it is a very important role of the nurse to determine the physical factors. Obtaining baseline data is the second and most important role of a nurse. Because this data collection would be helping to compare the intra and post operative period baseline data for the particular client. So basically, the baseline data will be collected in each phase of surgery, even in pre-operative, even in intra-operative and post-operative phase. Now, comparison will be taking place with all the baseline data in order to find out whether there is any sign of improvement is present for the patient after the surgery or not. Now, we're also going to see the nurses plays a very important role to determine the client's psychological status in order to cope up with the lifestyle changes after the surgery and promote the recovery after the surgical procedure. Even the nurses will be participating in the identification and the documentation of the site and the type of surgical procedure that would be performed for the particular client. So, meeting physiological and psychological need to promote the healing of the patient is a very essential role of nurse in pre-operative care. So now we are going to discuss in detail regarding the pre-operative assessment. So as we have learned in pre-operative nursing care, this is the first and major important role of a nurse. So let us see what is there inside the pre-operative assessment. So, as a nurse, you should make sure that while a patient is going for a surgical procedure, the assessment should be done in a proper way. It includes collecting the history or a history collection. Now, the history collection should be detailed and informative. So, first, we should collect the history regarding the present and past health or medical history of the client. So here we are going to ask the client regarding any other disease condition, whether it was present for the client or not, whether they are taking or they are on a particular medication therapy, that or those information has to be collected here. Next, we are going to discuss or we are going to ask the client regarding or any past, and also we are going to ask the client regarding their knowledge about the present surgical history. So here basically we are going to assess whether the patient has undergone any surgery before, and also we are going to discuss with them regarding the present surgical technique that will be performed for the client, as well as we will be assessing their knowledge related to the present surgery that has been planned for them. The next definitely includes a family history. So family history would be showing the presence of any other disease condition or cardiovascular disease condition that can be present for the client, or maybe by assessing a family history, we are going to learn about the client whether they are having an increased risk for development of any particular disease condition. Now, if it is a severe disease condition or if the person is having a high chances for the development of any disease condition, special treatment or special care should be taken over before the surgical procedure to minimize the development or minimize the progression of it, and also to prevent the occurrence of any life-threatening scenario. Data should be also to be collected regarding the patient lifestyle, regarding their dietary pattern, their rest and sleep, their exercise pattern, as well as their habits. Allergic history also to be considered, or also to be collected from the patient. So next, definitely we are going to ask about their obstetrical history or menstrual history if the client is female. So basically, the obstetrical history and menstrual history would be suggesting a medical professional whether they have any altered occurrence, or any disease condition has been taken place associated with it, or any alteration has been taken place, or any abnormal event has been occurred during the obstetrical surgery or not. Next definitely includes, as I mentioned, the usage of any prescribed or any drug that is available over the counter. So it is very important for him to note down the medication therapies if it is present for the client, or if the client is presently or any medication therapy. Next, we are going to see the review of every anatomical system should be ensured by the nurse. Basically, here after the history collection, our nurse would be performing a physical examination in detail. So the review of each system basically includes the cardiovascular system, or the review of it. So pulse, blood pressure, any presence of angina, hypertension, even any medical regimen that is related to or that is associated with cardiovascular disease has to be mentioned. So before or prior to surgery, a nurse would be performing a physical assessment where they will be assessing all this data related to the cardiovascular system. Next, review of respiratory system includes any history of or habit of smoking, or if there is any complaint of prolonged cough is present. Client also to be assessed for the presence of dyspnea. Their respiratory rate rhythm has to be measured. Any respiratory infection, if it is present, that also has to be noted in while doing a physical assessment. As well as we are going to auscultate the lung for any abnormal breathing pattern. So basically, this respiratory or review of the respiratory system would be helping a nurse to understand whether the patient is having any high risk for the development of any complication soon after the surgical procedure, or whether the client will be able to adjust and cope with a post-operative phase. Now, next we are going to see the review of neurological system. So here we are going to assess the orientation of the client, as well as their mental status and their level of consciousness. Past history of any stroke or neurological disorder also has to be collected. So basically, the orientation and the review of the mental status would be helping the nurse to obtain the legal documentation. So if the client is not having a proper mental status, or if they are not having, or if the patient is unconscious, we are going to see the nurses would be asking to sign the informed consent from the caregiver, but not from the patient. So for that, the neurological system assessment is very much important, as well as it is also important to note down whether the person have suffered from any kind of stroke or neurological disorder before. Next, we are going to see the review of genitourinary system would be done. So it is basically helping to identify whether there is any presence of infection or any pre-existing disease is present associated with it, which can or which may be triggered up after the surgical procedure. So special precaution should be taken care of those patients if there is any history or any pre-existing disease related to the genitourinary system is present. Hepatic system also should be reviewed or assessed. So basically, history of alcohol consumption here to be noted by or from the patient. Any history of IV drug usage also should be identified and noted down. So basically, we are going to see or we are going to check the client for the presence of jaundice or any hepatic disorders if the sign and symptoms are there for the client, to make sure the client is properly adopting in a post operative phase. Next, we are also going to assess the integumentary system for any presence of skin disorder or infection or certain wounds. Next, we are going to assess also the musculoskeletal system, which is basically includes the assessment of the skin around the pressure point. The gait of the patient also should be assessed here, the muscular strength, even the joint or muscle pain, if it is there for the client, that also has to be ensured. Now, gastrointestinal system should be reviewed for checking the bowel movement and their dietary intake and also dietary habit. The data should be collected regarding all this. Next, we are going to see the review of immune system. So, whether the patient is having any immune deficiency disorder or any autoimmune disorder, that has to be noted down. So, as surgical procedure increase the risk of infection, so definitely it has to be noted whether the client is already immunocompromised. In case of those client with a deficient immune system, we have to take some special precaution. So I hope you understood. The review of every system would be done prior to the surgery to ensure a proper recovery after the surgical procedure and promoting their health. So here we are going to see the assessment will be done for depending on the surgical procedure also. So basically we are going to see a overall head to toe assessment, and every system should be assessed prior to the surgery, and depending on the surgery which system it is including, that particular system should be focusedly assessed here. Next, we are going to read about certain very common diagnostic testing which should be ensured by a nurse for the client to make sure that their health status is adequate or sufficient to cope up with the post operative changes. So, first, in almost every patient who are a recipient of a surgical procedure, we are going to see the diagnostic test will be including a study of complete blood count. So here basically RBC, WBC, the hemoglobin and hematocrit level will be checked for the client prior to the surgery. So as we know, the surgery will be almost always involved a huge amount of blood loss. So it is to be make sure that the client will be having or client is in a healthy state where they will be able to cope up with the blood loss during the time of surgery. So next we are going to see even there are certain times in during the surgery or during the intraoperative phase where the transfusion of the blood and fluids to be done. There is a reason why even blood typing and cross matching should be ensured prior to the surgery. Now it is a nurse's role to ensure that the client is undergoing each and every diagnostic testing and studies prior to the surgery. Serum electrolyte also should be assessed. Urine analysis should be done to check whether the person is having any infection related to the genitourinary system. A chest x-ray will be basically showing if the person is having the presence of any infection related to the respiratory system. We are also going to see the usage of electrocardiogram. Now here electrocardiogram will be basically used to see whether the heart is having a normal physiological functional ability or not. Even the coagulation profile, the platelet count, and the hematocrit level or values checking should be ensured by the nurse to make sure that the client is having a healthy state in order to promote their recovery after the surgical procedure. ABG analysis often will be done to understand the partial pressure of oxygen and carbon dioxide for our client. Pulse oximetry often would be administered for the client to understand their saturation level or whether the person is in need of oxygen administration. Next, we are also going to see a blood sugar test also, or glucose test also can be done for the client prior to the surgery. The blood test would be done to understand the value of urea, nitrogen, or creatinine. This is basically would be suggesting whether the kidney or the urinary system is working or in a functional ability is proper or not. Now, next we are also going to see the usage of liver function test. So basically, it would be suggesting whether the hepatic system is working properly or not. For certain client, we are going to see the usage of even pulmonary function test to make sure that the person is maintaining a normal respiratory function. Next, we have, as we have discussed regarding all the diagnostic testing, by through this all assessment test, we are going to assess whether the client is having any physiological need prior to the surgery or prior to the intraoperative care. So the diagnostic test also would be helping the nurse and a medical professional to plan the surgery accordingly depending on the client's physiological state. So, as we have discussed regarding the assessment, now the second role of the nurse is assessment of the physical needs. So, here we are going to assess the client regarding their ability to communicate, the level of consciousness, their height and weight, as well as their exercise tolerance or their level of exercise, as well as their circulatory status. Now, these are very important part of the physical need assessment, which has to be ensured by a nurse for a client who is in a pre-operative phase. Also, we are going to assess the psychological need in this phase. So basically, the emotional need of the client has to be assessed, their coping strategies has to be assessed, support system or their support from the caregiver also has to be noted while doing a psychological need assessment. The client's level of understanding should be understood by the nurse in order to maintain or in order to promote their health, promote their health after the recovery. So basically, the level of understanding, depending on that, a nurse would be educating the client regarding the surgical procedure, regarding the need of it and expected outcome. Even the post surgical adaptation of their lifestyle also should be demonstrated or also should be described to the client depending on their level of understanding. Now we are going to read about the legal preparation, which basically means obtaining a informed consent. Now it is a very important role of a nurse to obtain a informed consent from the patient or in a special scenario from the caregiver of the patient who is undergoing for the surgical procedure. Now, what it is or what informed consent is, basically it is an active shared decision making process between the healthcare provider and the client. In informed consent, we are going to see there will be written the brief surgical procedure which has been planned for the client, the rationale behind the planning as well as the expected outcome, and the probable condition soon after the surgical procedure if it is performed for the client. So basically, it is a nurse's role to explain about the surgical procedure and the need and the rationale of it to the client so that they can understand the rationale behind even the need for the surgery. So once the surgical or informed consent is obtained from the client, then only the surgery can be planned. Now, in a scenario where the patient is unconscious or maybe the patient is having an age less than 18 years, we are going to see, as a nurse, we are going to collect or obtain the informed consent from the caregiver of the patient who is going under the surgical procedure. So, in order to obtain an informed consent, each nurse must be familiar with the agency's policy as well as the state laws regarding the surgical consent form. So next we are going to learn about pre-operative teaching. So pre-operative teaching, here we are going to see the teaching to the client should be done regarding the surgical procedure. So information would be varying depending on the type of surgery and the length of the hospitalization. It includes the topic like pre-operative medication and its use and the rationale behind the prescription, a post-operative pain control measures. Discussion also would be done with the client related to the monitoring of vital signs and the hemodynamic status of them. Explanation and demonstration would be done for the physical exercise for the post-operative management. Also, we are going to see the client would be demonstrated for deep breathing and coughing exercise to promote the recovery in a post-operative phase. Also, we are going to see the sometimes the patient would be demonstrated with the usage of incentive spirometry or the usage of the device like incentive spirometry, which will be after all improving the breathing pattern soon after the surgical period. So next we are going to see also sometimes we are going to demonstrate the client regarding the extremity and feet and leg exercise which has to be performed in post operative care. Also we are going to see the usage or we will be describing the client regarding the essentiality of the position changing after the surgical procedure. Post-operative IV lines and their administration and their rationale should be also described and discussed with the client in a pre-operative phase. Here in pre-operative teaching, basically we would be demonstrating and explaining about each and every method that would be used after the surgical procedure for a easy recovery. Now, pre-operative teaching also helps client to cope up with the post surgical trauma psychologically and physiologically. Physical preparation is the one of the most important nursing role in pre-operative care. So here we are going to see the preparation would be including the nutrition and fluid status of the client, maintenance of the hygiene of the client, administration of medication should be ensured by the nurse. A proper rest and sleep in the pre-operative phase should be ensured by the nurse. Special orders, if it is there related to the surgical procedure or related to the any medical therapy, should be administered or should be provided to the particular patient before going for the surgery. Removal of the prosthesis or care of the prosthesis sometimes is a very important part in a post-operative or in a pre-operative phase. So nurses have a very important role to managing the prosthesis. Next, we are going to see the surgical skin preparation also would be done prior to the surgery in pre-operative phase. Safety protocols of the client also should be maintained by the nurse. Also, hemodynamic status and vital signs should be essentially monitored and checked prior to the transferring the client to the operation theater. So, while maintaining the nutrition level and fluids balance in the body, we are going to see the adequate hydration and nutrition which will be generally promoting the healing after the surgical procedure. Hence, a nurse plays a very important role to maintain a adequate hydration and fluid and nutrition balance for the client. For a surgical client, NPO after the midnight before 1 day prior of the surgery should be ensured. So this basically will be following it anesthetic, which will be depressing the gastrointestinal function. So there would be increased chances of aspiration while the patient is on anesthesia. That is the reason the nil or oral should be followed, or the patient should not be given anything orally to eat. So only the IV administration would be done here in pre-operative phase according to the prescription. So nurses plays a very role to maintain the NPO for the client in the midnight or from the midnight of the day of the surgery. Bowel and bladder care should be taken care by the nurses for the client who is going for the surgeries. Enemas may be ordered to clear the bowel, and also the urinary output should be measured by the nurse to make sure that the client is having a well maintained urine output. Generally, a nurse should teach the client and ask them to shower in the evening and morning before the surgery. It helps to reduce the chances of the infection taking place after the surgical procedure. So, here we have learned regarding each and every role of the nurse that the nurse would be performing prior to the surgery or in a pre-operative phase. Now we are going to also discuss regarding the transportation of the client to the operating room. So this is the last and most important role of the pre-operative nurse, or the role of the nurse in a pre-operative phase. Here we are going to see the client may offered with a wheelchair or maybe a stretcher. Now if the client is having a well physical or well physiological balance, definitely sometimes the client may walk up to the surgical room if no sedative is administered there. Also, we are going to document the method of transportation prior to the transporting the client to the surgical room. Handoff communication should be given to the operating room or operating theater nurses. This is a very important and essential role of the nurse to provide a handoff communication to a nurse who is present in the operation theater. Situation background assessment recommendation model would be followed to provide the communication to avoid any adverse events related to the miscommunication between a preoperative nurse and a intraoperative nurse. Provides adequate information to the caregiver is also a part of role of a nurse in preoperative care. Here we are going to see, once the decision has been taken care of and once the client is completely prepared for the surgical procedure, a detailed information should be provided to the caregiver in order to manage their anxiety and in order to provide the adequate knowledge related to the surgical procedure of the client. So I hope you have completely understood the concept of preoperative care. So stay tuned to learn about the intraoperative care and the postoperative care and the nurse's role in these phases. Thank you so much for attending the session. We'll see you guys in the next session.